Well, thanks for joining us for another edition of Right Now with Rodney Live, everybody. We really do love bringing you content this way. So, again, I want to say thank you for tuning in. Like a lot of organizations, we've made a lot of adjustments during the pandemic. And one that we are really excited about is our 211 resource helpline. The 211 information and referral line has been so crucial to supporting our community for many years. And during this pandemic, 211 has become even more critical to help connect people with the services that they need. And I'm here today with Sondra Slavon, who is our Senior Director of Community Impact with Mission Families. She's going to give us an in-depth look at what is new with 211. So welcome, Sondra.
Thank you for having me, Rodney. I'm excited to be here.
Well, we're glad to have you. So tell us about 211. What is it and who does it serve?
So 211 is an information and referral helpline, a phone number that serves the same geography that our United Way serves. And it is open to everyone in our community. And it's a resource that will help connect people with human services. So community services, social services, health services. And it is manned by live people, community resource specialists, between 8:30 a.m. and 4:30 p.m., Monday through Friday. And after hours, we also have some automated voice responses. So if people want to call us at a different time, they can leave a voicemail. And so in addition to the 211 phone line, we also have a web page as well, where people can look at resources on their own.
Well, that's great. 211 has continued to serve our community during this pandemic. And how were we able to make that work?
Well, the pandemic was a big challenge because we went from working in an office and answering an office phone system to working remotely. So we had some technological challenges that we were able to meet. And so we also had an increase in call volume because, as you all might suspect, needs have increased dramatically in the context of COVID-19. For example, in 2019, we received about 1,600 phone calls, and in 2020, we received over 2,900, so almost double. We also, in the context of COVID, we needed to be sure we were keeping up with the changing landscape of resources and where and when they were available, if they were open, if it was in-person, remote, what was the delivery system, things like that. So we did a lot of things to pivot and make sure we were still available to meet the needs of the community. One thing we did is we partnered with United Way worldwide, and they offered us an IVR, an automated system, so that folks who called up with questions about COVID-19 resources could get answers to their questions without having to wait for a live agent, for example. We also hired additional staff. So now we hired a new 211 associate. And then over the course of this continuing pandemic, we realized that we wanted to have a phone system, a more robust phone system. And so we now have a web-based phone system, which allows us to field phone calls anytime, anywhere. And we have a new database, which is much more user-friendly for our team. And so in addition to the system upgrade, we have an updated resource directory on our website, which is also very user-friendly for folks who are looking for resources. It includes guided searches, and those guided searches are built on the most frequent searches from our website visitors. So we think it's going to be easier for people to find what they need and also find a suite of what they need, because they may not be thinking about all the stuff that's available to them. So we're very excited to offer that.
Well, that sounds great. Thinking about technological improvements and certainly understanding the landscape and how services can be improved for more quality assurance as well as delivery and addressing the needs that so many people in our community have expressed through this pandemic and even prior to that. You've learned a lot from certainly going through this pandemic. You've mentioned some of the improvements, But are there other improvements that are in the works with 211?
So one of the improvements that I'm really excited about is that our new phone system is going to enable us, or does enable us, to do live transfers of telephone calls. So, for example, if somebody calls up and they have experienced domestic violence and need services, they can get transferred right away to our Family Advocacy Center to be connected with the supports that they're in search of. If we have a caller that is calling, like Rodney, if you called me and you needed support with a food bank and you felt like you needed to connect directly with somebody, we also have the ability to do a live phone call transfer. So I can connect you directly with my contact at that organization. And being able to do that does a couple of things. First of all, we are assured that the caller gets access to the resources that they need. And then it also helps us know whether or not they're getting the information we need. One of the other elements of our new system is that we can do quality assurance calls with callers to find out, did they get the resources that we had hoped that they would get? Could we do a better job of offering even better referrals for them? So we're really looking at continuous improvement and using the data from our new system to drive that improvement, to better serve our community.
That just sounds great. That was one word that was going through my mind: continuous improvement. And certainly the pandemic, created a challenging circumstance for our organization. But for us to show the ability to pivot and focus on how could we improve services and delivery, and not just with what's happening now, but even looking to the future, because we know we want to create kind of this full loop system where folks can get a call in for referral and support, and then get connected to the services that they need for us to be confident, I think is big. So, as well as I do, because you work for the organization, that we're in the process of aligning our work with diversity, equity, and inclusion values. And many people of all walks of life have been affected by this pandemic, and people are seeking information from the 211 helpline at a higher rate than ever before. You've shared that. With those perspectives in mind, how are we moving forward?
So we're doing a lot of things. Like, one of the things that we're doing, you mentioned closing the loop on referrals. And so to me, that's two things: making sure the caller gets what they need and making sure that the resource gives the caller what they need. Also, sort of the nature of our calls has shifted a bit. So over this pandemic, we've had a over 300% increase in calls about food and meal support. We've had a 300% increase in calls about mental health and addiction. And so that's going to help inform us as a community about, are there any gaps in resources that our communities don't have access to or that don't exist? Is there something that United Way could support in catalyzing and putting together for the community? The other thing is, with regards to equitable access, we want to make sure that our 211 is available when people need it. We want people to get access to the resources that they need when they need it as well. And so we're going to monitor our data to make sure that we're staffing at the appropriate hours. And in addition to that, we want to eliminate any barriers to accessing resources that we possibly can. And so one of the challenges on the horizon that we're really looking forward to addressing is language barriers. So we're looking forward to having bilingual language support on 211, and that's going to be something that we are looking toward. And so if anybody that's listening would be interested in participating, please let us know. You can reach out to us at our United Way webpage. But so we're trying to increase language access, reduce those barriers. And then we also want to make sure that we're responding quickly and comprehensively. And that's really the difference between a 211, an information and referral system, and just a database. So when you call 211, our community resource specialists are going to listen to what you share and ask some questions to really drill down to get a very good idea about what you might need. And then they're going to use their expertise to offer some other potential resources that the caller may not have even thought of. So we're really excited about meeting people where they are and are looking forward to becoming a multilingual 211.
That's phenomenal, Sondra, that you and the team have really taken steps to modernize, to digitize, and to certainly make 211 a more effective tool to help support so many needs in our community. And again, looking at all avenues for inclusivity, access, and to ensure that those services are delivered. Do you have any final thoughts you want to share?
Well, I just want to reiterate that 211 is available to anyone, so please give us a call. We have all sorts of resources, and we have trained experts who can find those based on your zip code and geography. We encourage people to call when they are in need, and you can call on behalf of somebody else. Maybe you have someone in your household that you feel could benefit from some local resources. Give us a call and let us try to help out. And if you're curious about what else we have to offer, please know that more information is on our website. And give a try to our new 211 public-facing resource directory and see what you think. We're excited about it, and we think we have a lot to offer. And the sky's the limit as far as potential goes. Call us, let us know what you need, and we'll do everything we can to help.
Thank you, Sondra. The sky's the limit. I love that term. So thank you so much for joining us for this edition of Right Now with Rodney. And to see the complete set of interviews, check out our YouTube channel. And I encourage you to like and subscribe.